Hi, my name is Lorraine Moorhead. I'm a therapist and a clinical supervisor operating out of Scottsdale, Arizona. While I see all types of different clients in my day-to-day practice, there's one type that I am referred to above and beyond more often than anyone else. This type is a little bit complicated of a presentation because they have been so successful, and by all accounts, they would say that they're achieving all of the goals they set out to achieve, and they have a great understanding of where they want to be and where they're going. So some of the significant traits of this person are that they might describe themselves as either quick to shut down anger because they want to see themselves as sort of easygoing, hard to rattle, or the opposite is true. They might consider themselves quick to anger, and they might even be considering anger management. This anger, either presentation might have served them in their career, either by just going with the flow, taking on more, always being willing to do more or step up to a challenge, or they might see that their anger has led them to be perceived as a leader in the workplace, has helped them climb the ranks, and has helped their potential team members see them as somebody who is not going to be taken advantage of and will stand up for their team. Sometimes it's that the person is either pursuing a relationship or has gotten into a relationship that they decide that they want to change some of these traits. Sometimes they're prompted by a significant other to either begin to manage their anger differently or improve their communication to share a little bit more about their experience instead of trying to keep it all together. They might be facing relationship challenges now, and that could be at work or at home, and hoping to improve upon their relationships. They might be hoping to increase their emotional regulation and their ability just to identify and handle their emotions. They might see a link between something that happened earlier on, sometimes in childhood, but sometimes just before now. They might see how that event impacted them, but oftentimes they won't feel like they're pursuing help because of the event. They kind of see it as two separate things, and sometimes it is, but often I would say more often than not, there is likely more of a link than you expected between these really significant issues such as childhood trauma that occurred, the experience or the reactions that you're having now. Sometimes EMDR therapy can be a big help with that. That's something that I am certified in, and I am able to offer consultation to other EMDR therapists on EMDR. They might also want to address a potential diagnosis, a previous diagnosis, or just see if some of the diagnostic traits that they've heard about are linking to some of the symptoms that they've been experiencing. If you identified with some or all of those, then you might be the type of client that I see the most often. Now, I see individuals all over the state of Arizona via virtual therapy, and I am able to see in-person clients in Scottsdale, Arizona. That could be expanding in the future as some legislation has been changing in terms of our licenses, so keep an eye out for that. If you'd like to move forward with scheduling today, then just go to lorrainemoorhead.com and you can click the Schedule Now button for a free consultation.